It is 1880. You are a woman. You feel stressed, sad, or simply tired. You go to your doctor. He listens for 30 seconds, nods slowly, and writes one word on his notepad: hysteria. And then he prescribes you a treatment so bizarre, so awkward, so completely absurd that when modern doctors finally figured out what was happening, they removed the entire diagnosis from medical records and never spoke of it again. This is the story of the strangest medical chapter in history, and it lasted over 2,000 years. Stay until the end, because the invention that came out of this story is still in every pharmacy in the world today. Hysteria was a medical diagnosis, an official one, used by real trained doctors. And the list of symptoms that could get you diagnosed with it is genuinely one of the most ridiculous things ever written in a medical textbook. Feeling anxious? Hysteria. Feeling sad? Hysteria. Feeling too excited? Also hysteria. Reading too many books? Hysteria. Wanting a job? Hysteria. Disagreeing with your husband? You guessed it. Hysteria. At one point in the 1800s, historians estimate that over half of all women in Western Europe had been diagnosed with hysteria at least once. More than half. Of all women diagnosed with a disease that did not exist. Here's the contrast that makes this story so extraordinary. The same symptoms that Victorian doctors called hysteria in 1880, anxiety, fatigue, low mood, stress, irritability, we have names for all of those today. We call them anxiety disorders, depression, burnout, chronic stress. They are real, they are treatable, and they affect men and women equally. But in the Victorian era, the entire category was handed to women, given a single ridiculous name, and treated as if the problem was the woman, not the world she was living in. This diagnosis did not start in the 1800s. It is far, far older than that. The word hysteria comes from the ancient Greek word hystera, meaning uterus. Ancient Greek physicians, including Hippocrates himself, believed the uterus could literally wander around the female body. If it drifted up toward the throat, it caused anxiety. If it moved toward the heart, it caused palpitations. If it got confused and floated sideways, it caused, well, everything else. The treatment in ancient Greece was to lure the uterus back to its correct position, using pleasant smells applied below and unpleasant smells held near the nose. This was written in actual medical textbooks, taught in actual medical schools, and remarkably, the core idea that women's emotions were controlled by their reproductive organs survived in Western medicine, almost unchanged, for over 2,000 years. But here is where the Victorian era took this ancient nonsense and made it genuinely historic. Because in the 1800s, medicine had modernized significantly. Doctors had better tools, better knowledge, better understanding of human anatomy. And yet, they looked at this 2,000-year-old theory about wandering uteruses and decided to keep it. Not just keep it, expand it, market it, and build an entire medical industry around treating it. So what were the treatments for hysteria? The early treatments were fairly standard for the era and genuinely terrible. Rest cures where women were confined to bed for months, forbidden from reading, writing, or having any mental stimulation whatsoever. Charlotte Perkins, Gilman, a writer, was prescribed a rest cure in 1887. She was told not to write, not to work, to do nothing but rest. She later wrote that this treatment nearly drove her to actual madness, and wrote a short story called The Yellow Wallpaper directly about the experience. Some women were sent to sanatoriums, essentially locked away, for symptoms we would today recognize as grief or postpartum depression or simply unhappiness. But there was one treatment that stood apart from all the others, and this is the part of the story that makes medical historians visibly uncomfortable to this day. Victorian doctors decided that many of the symptoms of hysteria, the tension, the irritability, the emotional distress, could be relieved through a medical procedure they called pelvic massage. They called it a treatment. It was performed in a clinical setting. It was billed as a medical appointment, and it worked, in the sense that patients reported feeling significantly better afterward and came back for regular appointments. The appointments became so popular that doctors found themselves booked out for weeks. Which brings us to the part of this story that nobody expected to become a significant moment in the history of technology. Because doctors were not happy about this situation. Not for the reason you might think. They were not uncomfortable with the ethics of it. They were uncomfortable because it was physically exhausting and took a very long time. One Victorian doctor wrote in his journals that the procedure was tedious, time-consuming, and not at all what he had trained years of medical school to do. He needed a solution, a mechanical one. Quick pause. If you are finding this history genuinely unbelievable, subscribe right now. This kind of story is exactly what we cover every week. Back to the Victorian era. In 1880, a British doctor named Joseph Mortimer Granville patented a device he called the percuteur. It was powered by a hand-cranked motor. It was marketed and sold as a medical instrument. It was listed in medical supply catalogs alongside stethoscopes and surgical tools. Its purpose, according to the patent, was to relieve muscular tension through mechanical vibration. This device is widely cited by historians as one of the earliest predecessors of what would eventually become the modern vibrator. And it was invented, not for the reason most people assume, but because a doctor was tired and wanted to finish his appointments faster. By the early 1900s, electric versions had appeared in home appliance catalogs, advertised alongside fans, toasters, and sewing machines, as a device for relieving headaches and muscular fatigue. It was sold openly in mainstream magazines to ordinary households. Here's the contrast that defines this entire chapter of history. Victorian society was deeply, aggressively repressed when it came to discussions of women's sexuality, women's bodies, and women's autonomy. Women were expected to be silent, modest, obedient, and yet, within that same society, the medical establishment was openly prescribing and mechanizing intimate physical treatments, sold as clinical medicine, and nobody questioned it because it was framed as treatment for a disease. The label changed everything. Call it desire, and it was scandalous. Call it hysteria, and it was medicine. So how did this finally end? The diagnosis of hysteria began to collapse in the early 20th century as psychiatry developed more rigorous frameworks for understanding mental health. Sigmund Freud, whatever one thinks of his broader theories, was one of the first major figures to argue seriously that what doctors were calling hysteria was actually the result of psychological trauma and unresolved emotional conflict, not a wandering uterus. This shifted the conversation from body to mind and opened the door to treating the actual underlying conditions. In 1952, the American Psychiatric Association published its first diagnostic and statistical manual of mental disorders. Hysteria was not in it as a unified diagnosis. The wandering uterus theory, which had survived in Western medicine for over 2,000 years, was finally officially over. But here is the part that should stay with you. Because hysteria did not disappear, it just got renamed and redistributed. Many historians and psychiatrists argue that in the decades after hysteria was removed as a formal diagnosis, many of the same patients, women with anxiety, depression, trauma responses, and stress-related illness, continued to be dismissed, undertreated, or labeled as difficult, emotional, or attention-seeking. A 2016 study found that women experiencing acute cardiac symptoms in emergency rooms waited an average of 29% longer to be seen than men with the same symptoms, because their pain was more likely to be attributed to anxiety. The label changed. The bias did not fully disappear. So here's what this story actually is. It is not just a funny footnote about Victorian weirdness. It is not just an awkward origin story for a household device. It is a 2,000-year case study in what happens when a society decides that one group of people's emotions, health, and experiences are less real less valid, and less worth treating seriously than in other groups. And it is a reminder that medicine, like everything else, reflects the biases of the world it exists in. The good news is that it changes, slowly, imperfectly, but it changes. If this video made you think about something differently, drop a comment. I genuinely read every one. And if you want more of this, history that is stranger, more uncomfortable, and more relevant than anything you learned in school, subscribe. New video every week. See you there.